Hello ladies and gentlemen, and welcome to another video at the Pharmacist Academy. Woo! In this video, I'll show you exactly how to interpret a hepatitis B panel in the easiest way possible. Now, clinical practice is in a phase of immunologic therapies, and a lot of these agents can exacerbate symptoms of chronic viral infections like hepatitis B. So as a pharmacist, you must be very familiar as to how to assess the hepatitis B panel for a patient and to determine if he or she should be on hepatitis B prophylaxis. Now, the hepatitis B virus is one of the leading causes of chronic liver disease and hepatocellular carcinoma. One in every third individual has been exposed to the hepatitis B virus, and approximately 350 million people worldwide suffer from the chronic hepatitis B infection. Now, the downside to this is that only a few actually know that they have this chronic infection. It's transmitted through the blood, semen, and other body fluids, and is divided into two main types, acute versus chronic. Patients with acute hepatitis B, there's 2 to 3 months average incubation, but can range from 1 to 6 months. So basically, when you develop hepatitis B, right, within 6 months, that's considered acute. If it's treated, right, if your body's able to like fight this infection within 6 months and the levels become undetectable, right, because you can't cure this, right, you can't clear this virus completely from your body. You can make it undetectable, right? It's very similar to, HIV or herpes. These viruses become dormant, right? They remain dormant in your body. So you may be able to make the levels undetectable. Your body may be able to suppress it to the point where it's undetectable. Within 6 months, that's acute phase. So most patients clear virus, like I mentioned, completely without treatment and become fully immune within 6 months. 2/3 of patients, present with asymptomatic disease. So that's majority of the patients. And the ones that present with symptoms usually includes very mild symptoms, right? Like loss of appetite, muscle pain, low-grade fever, stomach ache, very non-specific symptoms. For patients with chronic hepatitis B, they develop this infection. Within 6 months, their body couldn't fight this infection, right? The body could not make this hepatitis B virus undetectable. So after 6 months, it's considered chronic, right? You have a chronic hepatitis B infection. And unfortunately, we see this a lot in our younger patients. Now, most patients with chronic hepatitis B are in the inactive stage. And you may think this is good, but this is actually kind of scary, right? Because they don't even know that they have it, you know? And, the patient has normal AST, ALT levels, little viral replication, minimal liver inflammation. Majority of them are asymptomatic. General symptoms, if experienced, would depend on the level of liver damage because at this point, your liver has been taking hits from this virus that's been in your body. Your body's still trying to fight it after 6 months. So you're experiencing more symptoms, right? More severe symptoms at this point, right? So anywhere from ascites, splenomegaly, spider angiomas, these are like the kind of presentations we see in somebody with liver failure. Hepatic encephalopathy. It may also lead to cirrhosis and hepatocellular carcinoma. And these patients are at a high risk for hepatitis B reactivation, which I will discuss as we go on. Now, this is the structure of the hepatitis B virus. And here we have the partially double-stranded circular DNA. And here we have the DNA polymerase, which is very important for DNA replication of this virus. On the outer layer, we have the surface antigen, which is simply the protein on the surface of the outermost layer of the virus. Then we have the core antigen here, which is simply the inner core protein, right? And we also have these envelope antigens here. Now, the hepatitis B surface antigen can be detected in the serum during acute or chronic infection. So once you get this infection, the levels of your hepatitis B surface antigen rises, and it basically remains in your blood, right? It stays there for a very, very long time. And for patients who have chronic diseases, which become so inactive, it gets to a point where levels of this may drop. But majority of the times, it's positive. It just stays there. It only becomes undetected when you develop immunity. So you develop this infection within 6 months, your body said, no way, you're not going to stay in here. Your body fight this infection, and now it becomes undetected, right? The levels becomes undetected. That's when the hepatitis B surface antigen basically becomes undetected also. That's when you test for it is going to be negative in that case. The hepatitis B surface antibody, now this is produced by the body as a normal immune response to the infection. So as your body is trying to fight this infection within the 6 months, if it's able to do this successfully, your body will create that memory, right? Your body is going to develop immunity. So that's when it creates this hepatitis B surface antibody. And this is, it indicates recovery and immunity from the hepatitis B virus infection. Now, keep in mind that when you get the vaccine is created from the hepatitis B surface antigen, right? They use that protein to develop this inactive vaccine. So once you get this vaccine, your body develops immunity to it. You're gonna have hepatitis B surface antibodies. Hepatitis B core antibody. Oh my God, this one does not. It's so straightforward. As long as this is positive, the patient had some kind of infection. I don't know if it's acute infection. I don't know if it's chronic. All I know is that at one point in their life, it could have been yesterday, it could have been 30 years ago, 4 years ago, whatever. At one point in their life, they were exposed to this virus and developed the infection. Hepatitis B envelope antigen. This is detected in patients with a new acute infection, and it reflects active viral replication. Now you have IgM antibody. Now, every time you see IgM antibody, just think of acute, right? Something acute is going on. So when this is positive, right, the antibody, when it's positive, it indicates acute infection with the hepatitis B virus. Next, we have IgG. Now, IgG is more of a chronic phase immunoglobulin. It remains positive indefinitely as a marker of past hepatitis B virus infection, very similar to the core antigen, except the core antigen actually increases, except the core antigen, the antibody to that, actually will increase before the IgG. Now I have this here to kind of, clarify exactly what I just spoke about. So the title is Acute Hepatitis B Virus Infection with Recovery, Typical Serologic Course. Keep in mind when I'm going through this, I'm going to talk about the acute hepatitis B. I'm going to describe it on this diagram. Then I will describe it with recovery, which they're showing you right now. And I'm going to show you how it is when the patient actually develops chronic disease. Now on the y-axis, we have the titers, which is simply the blood concentration, right, of these proteins. On the x-axis, we have the weeks after exposure. Now the colors here, the purple is for the hepatitis B surface antigen. The orange is for the IgM antibody to the core antigen. The blue is for the hepatitis B surface antigen, right? The antibodies to that surface antigen. And then you have the green, which is right here. And this is the antibodies, right, to the core antigen. Now, the patient develops an infection here. What do you see right away? After some time, levels of the hepatitis B surface antigen is going to rise. And it's going to remain in the blood, right? So you could always detect it, whether acute, so whether you clear this within 6 months or not, this is going to remain in the body. It's only going to drop if your body is able to fight this infection on its own and develop immunity. So then the hepatitis B surface antigen is going to drop, and then you're going to develop the antibodies to it after some time. Keep in mind also when you have this acute infection, right? When you have this initial infection, you're going to see hepatitis B envelope antigen in the blood, right? It's mainly for the acute phase because it signifies replication of the hepatitis B virus. And you have here where the patient develops symptoms after some time, and you can see the symptoms makes up a small portion of this whole thing, right? So that tells you a lot. That majority of these patients are usually asymptomatic. Then you have the core, right? The core, like I said, once you get the infection, the core increases, and it's there for life, regardless of if you was able to fight this infection within 6 months, the core is not coming back down. The core is always going to remain positive. The hepatitis B antigen, right? The surface antigen will come down if you're able to fight this infection, but the core will remain positive. The IgM is acute phase. So what does that mean? It's going to rise after some time, right? During the acute phase, but then it's going to come down. It doesn't stay there for long. I think I went through each one. Now, hepatitis B virus reactivation. Now, this is an abrupt increase of hepatitis B virus replication in the blood of a patient with inactive, so like the chronic carriers, or resolved hepatitis B. So somebody who was able to develop immunity to this virus, right? So like you get, like cold sores, right? It's from the herpes virus. You develop immunity. You actually have immunity to it, right? That's why you're able to suppress that virus. That's why you don't have like breakout symptoms all the time. You're able to suppress it. But if anything causes immunosuppression, boom, it comes back. So very similar to this, right? That's when it reactivates. That's when the hepatitis B virus will reactivate in those kind of patients. So mechanism, after an infection, the hepatitis B virus specific T cell and B cell antibodies suppress the viral replication, right? They keep this virus in check. Suppression of this T and B cells will lead to an increase in replication of hepatitis B virus, which makes sense. The guys who are keeping this virus in check are not there anymore. There is low numbers of those guys, those T cells and B cells. So what's going to happen? The virus is going to feel free. They're going to feel like they could do whatever they want, and they're going to start causing a lot of problems. Here are some of the risk factors. The ones that I'm going to focus on the most is the immunosuppressive medications. So I have some examples here, but it's not only limited to chemotherapy and steroids. As you can see here, there's a bunch of medications here from different classes, and they're used for different diseases. The ones that I see mainly in my practice is rituximab, ofatumumab, ocrelizumab, prednisone, of course. I'm sure everybody sees this, chronic use of prednisone, or any other steroid, really. Alemtuzumab, I see that also. Infliximab, very common. I see a lot of doxorubicin, epirubicin, here and there. Imatinib, I see that. Nilotinib. Okay. Now, some of these medications have, package insert recommendations that's, telling us to, screen these patients baseline, to get their baseline hepatitis B status before you start these medications, because these medications can deplete your B and or your T cells. When to screen for hepatitis B and who to screen. Screen for hepatitis B virus prior to beginning any of those immunosuppressives, right? You won't know, like, this disease is usually asymptomatic. Sometimes the patient's liver enzymes are normal, right? Like, that's pretty scary. So you will never know until you screen the patient. Screen for hepatitis B virus after diagnosis of any disease that could, cause your B cells and your T cells to deplete, right? Like lymphoma, for example. So you want to make sure the patient doesn't have some kind of chronic hepatitis B virus just hiding somewhere in the body, but it's suppressed because you have your B cells and your T cells doing a great job, and now you're going to suppress it with this disease. You want to make sure it doesn't reactivate, because once it reactivates, there's a problem. Screening should include, usually the hepatitis B surface antigen, right? Like I said, that's usually positive once you had an infection before. The antibodies to the hepatitis B core antigen. Once this is positive, you had some infection, right? You had some infection. That's how we interpret it. And the antibodies to the hepatitis B surface antigen. That will help us determine if you recovered from it, if you had the vaccine also, right? Then, sometimes we include the IgM because that's really good to tell us if the patient is having some kind of acute hepatitis B phase, right? So if the patient's AST, ALT levels are high, you're having a lot of this stomach discomfort, jaundice, we may want to check, does this patient have hepatitis B, right? And is it acute, right? So then we want to treat the patient right away. Some of the other proteins is very institutional specific for them to like test and screen for it. So you do your serologic testing and you get the results back. What are you going to see? You have different options. So the first thing I always look at is the hepatitis B core antigen, right? The antibodies, right? The antibodies to the hepatitis B core antigen. If this is positive, the patient had some kind of infection. This one is negative. We got nothing to worry about. The patient never had an infection. Hepatitis B surface antigen is usually present, right, when the patient has an acute or chronic infection. This one is negative, right? This one is negative too. So the patient never got the vaccine. Remember, the vaccine is created from the hepatitis B surface antigen. So if the patient develops antibodies to the surface antigen, it could be because of the vaccine, right? Especially when this is positive also. Usually this has to go down, right? So they wouldn't be positive at the same time. But anyways, interpretation, the patient never had an infection. They never received the vaccine, right? So now we could say that the patient is at risk of a possible infection. Maybe we should recommend the hepatitis B vaccine for this patient. Next, we see that the antibodies to the hepatitis B core antigen is positive. Okay, so the patient had some kind of infection. Now we see that there is hepatitis B antibodies to the surface antigen. Okay, so it's either the patient got the vaccine, that's why this is positive, right? They develop immunity to the vaccine, that's why this is positive, or they got this infection according to the core antibody, but then they were able to clear it after some time. That's why this is negative now, right? Because usually we expect if the patient had some kind of infection according to the antibody to the core antigen is positive. If we know the patient has some kind of infection, we expect this to be positive also, but it's not. Right? So probably the patient cleared it and developed immunity right here. So immune due to a previous infection. Patient had an acute infection and the body was able to fight the hepatitis B virus and clear it. Management, the virus can reactivate, right? As long as you get the infection, it's in you for life. Okay? There is no cure. It's always there. If you suppress the immune system, there is a risk of reactivation. In this case, you want to recommend the hepatitis B virus prophylaxis before we start those, immunosuppressive medications that I listed in the previous slides. We come here. The antibodies to the hepatitis B core antigen is negative. Patient never had an infection. The hepatitis B surface antigen is negative. If this is telling me patient never had an infection, that means this was never positive, right? This was never positive. So it doesn't mean that the patient cleared the virus because they never got it in the first place. But the surface antibodies are still positive. Oh, wait. They probably got the vaccine, right? This patient probably got the vaccine. That's the reason why. So in this case, it's good to go. You could start your treatment with those medications. Yeah. We come here. The antibodies to the hepatitis B core antigen is positive. Okay, patient has some kind of infection. The hepatitis B surface antigen is positive. Okay. The surface antigen, the antibodies to the surface antigen is still negative, which makes sense, right? Because they don't turn positive at the same time or negative at the same time, right? The way I see it, patient has an infection, so this rises. Patient has an infection, this will rise. This is only going to come down if you develop immunity to the virus, right? So it's still positive. So it's most likely an acute phase. And that could be confirmed by checking the IgM in this case, right? The IgM antibodies were also positive. Currently in the acute infection phase, so 6 months or less, right? They're still in that phase, let's just say. Management of acute infection, right? You have to manage that, right? The patient has to recover, right? They have to develop immunity from that, if that's the case, or be treated before beginning immunosuppressive therapies. We come here. The antibodies to that hepatitis B core antigen is positive. Patient has some kind of infection. The hepatitis B surface antigen is positive. The antibodies to the surface antigen is negative, right? But in this case, the IgM is negative. So this patient has a chronic infection, right? So this is mainly for acute phases. This is probably, going to stay like that. Why? Because the patient never developed immunity to this, to the virus. They were unable to fight it, which kind of explains why they're in the chronic phase now. You were unable to fight it, so this is just going to remain positive. This, of course, is going to remain positive because you got an infection in the first place. you will never develop you didn't develop the antibodies to the surface antigen because you weren't able to fight it, right? And then the IgM is negative. The virus can reactivate in this phase, right? Because you had the infection. So you want to recommend HBV prophylaxis. Now, this is the one that gets a little tricky. This is very unclear where the antibodies to the hepatitis B core antigen is positive, but everything else is negative. These two things right here, right? So in this case, you could say the patient resolved from an infection, most common, and let's just say the antibodies to the surface antigen hasn't developed yet, possibly. False positive, antibodies to the core antigen, right? So this is actually, it should have been negative, but it's positive. So that means the patient is still susceptible to an infection. And this is actually supposed to be number 3. So resolving acute infection, all right? So like I mentioned earlier, it's still in the process of resolving, and the patient hasn't developed the antibodies yet to the surface antigen. So when you're giving the patient prophylaxis, when they had the infection before, whether they were able to develop immunity on their own or it's in the chronic phase right now where it's inactive, the patient requires prophylaxis, right? Because once you're exposed to the virus, it's not going anywhere. So first line is entecavir, and these are all PO medications, and we have the alternatives here. Now, lamivudine is also used for hepatitis B, but it's not recommended for prophylaxis in these patients because studies actually found that even though patients got prophylaxis, some of them still had reactivation, and that's due to resistance associated with that. So you want to maintain prophylaxis for 6 months after you stop the chemo or other immunosuppressants, but 12 months for B cell depleting therapies like rituximab. So the final takeaways: 1 in every 3rd individual has been exposed to the hepatitis B infection. Acute hepatitis B infection usually resolves within 6 months. Unfortunately, for younger patients, most are unable to fight the virus and develop chronic infection after 6 months. Symptoms of a hepatitis B infection can range from loss of appetite, nausea and vomiting, muscle pain to jaundice, ascites, AST/ALT elevation, and more serious cirrhosis. Carriers of the hepatitis B virus are at risk of reactivation in the setting of immunosuppressants that deplete B and T cells or T cells. Prophylaxis with entecavir is the preferred regimen in carriers of hepatitis B virus prior to initiating immunosuppressants. Now, I hope I was able to cover the main important things you should know about hepatitis B virus and when to screen for it, who to screen for, and what to do after you get the results back. If this video was helpful, make sure to like, comment, subscribe, and share it. Tell a friend to tell a friend. I know there's a lot of people who are not comfortable with this concept or, interpreting a hepatitis B panel. So I really hope those same people will come across this video one day. But if you know anybody like that, please share with them. Until then, thank you all for watching and take care.